Welcome to the We Level Up Treatment Center video series. In today's video we will discuss anhedonia. Have you ever felt like you can no longer find joy in things that used to make you happy? Do you find yourself losing pleasure in activities you used to enjoy? Then, you might be experiencing anhedonia. It is a psychological condition characterized by the inability to feel pleasure or to be able to experience feelings of joy. The condition is often associated with depression, anxiety, and other psychiatric disorders. Linked to mental health disorders. The disorder is closely linked to depression, anxiety, and other mental health disorders. It is common among individuals struggling with a mental health disorder and can be a symptom of depression. It can also be seen in those recovering from traumatic experiences or going through emotional times. The two types. Generally speaking, there are two types of anhedonia: physical and social anhedonia. Social anhedonia involves the inability to enjoy activities and interactions with other people. On the other hand, physical symptoms involve the loss of pleasure or enjoyment in activities or experiences that do not include other people or relationships. The two main types of this condition are illustrated below with examples. Social anhedonia. You don't want to spend time with other people. Physical anhedonia. You don't enjoy physical sensations. For instance, an embrace does not stimulate you. You feel empty with it. Your favorite dishes have a bland flavor. Even sex can become dull with sexual anhedonia. Social anhedonia can manifest as difficulty forming attachments to others, avoiding or being anxious in social situations, a strong preference for being alone, and difficulty expressing emotions. Additionally, people experiencing social anhedonia may find it challenging to appreciate jokes or to be entertained by activities that involve other people. Physical symptoms involves difficulty experiencing pleasure or enjoyment from activities such as eating, exercise, hobbies, or sexual activity. Anhedonia symptoms. People with physical symptoms may find that activity that once brought pleasure no longer generates positive feelings or emotions. They may struggle to feel motivated to engage in activities they once enjoyed and can often feel overwhelmed when thinking about engaging in them. They may also have difficulty understanding or appreciating things that might otherwise be enjoyable for other people. This can considerably impact the person's well-being and ability to form relationships with others. Symptoms of social anhedonia may include very few or no relationships at all, complete withdrawal from existing social relationships, a diminished capability to express emotions, fake emotions in social situations, e.g., pretending to be happy at a celebration, preference for being alone. Physical symptoms may include a complete loss of libido, ejaculatory anhedonia, or interest in sexual interactions, frequent illness or other physical health issues. Causes of anhedonia. Unfortunately, what causes this condition explicitly is unknown. Studies show this condition could be intimately related to some mental functions. Researchers discovered that depression anhedonia frequently involves the area of the brain that manages motivation, anticipation, decision-making, and rewards. They postulated that individuals living with this condition might be incapable of motivating themselves and anticipating positive outcomes. They also struggle to estimate the work necessary for a particular reward appropriately. This condition is connected to several mental health conditions. It is regarded as one of the main characteristics of depression. Moreover, physical and social anhedonia are frequently reported by those with schizophrenia. This condition has been linked to bipolar disorder depression, according to research. Doctors use the degree of anhedonia to measure the severity of a patient's bipolar illness. Furthermore, symptoms like anhedonia may happen when using recreational drugs or going through withdrawal. Additionally, studies have shown that those with this condition may be more inclined to begin using recreational substances. They might also be more prone to develop addictions. Risk factors. Risk factors include a family history of schizophrenia, bipolar disorder, or major depression. Females are at a heightened risk of suffering from this condition. Other risk factors include eating disorders, a history of abuse or neglect, recent trauma and heightened stress, major illnesses. If you have been diagnosed with depression or schizophrenia, there is an increased risk of developing this condition. Living with PTSD from a traumatic event or events may put you at risk of this condition. Overlap with other mental health problems. Anhedonia can occur in various mental health conditions, making it difficult to diagnose and treat. However, recognizing the presence of the disorder is a crucial step in getting proper treatment. Talking to a qualified mental health professional is essential if you are experiencing a lack of pleasure. Anhedonia versus avolition. Affective flattening. Alogia, avolition and anhedonia are all negative symptoms of mental illnesses such as schizophrenia. The main difference between avolition and anhedonia is that avolition is a total lack of motivation, making it hard to get anything done. In comparison, this condition refers to losing the ability to feel pleasure. Apathy versus anhedonia. To differentiate the difference between anhedonia versus apathy. First, this condition is distinct from apathy. While apathy refers to a lack of motivation or energy investment on many levels, this condition is the lack of a specific feeling, pleasure. It can, however, be a sign of apathy. Anhedonia bipolar. This condition is a hallmark of depression and is highly prevalent among individuals with bipolar mood disorders. Anhedonia BPD. BPD is a disruptive, complex condition that often occurs along with other mental health disorders and anhedonia. Many people with BPD also have depression. The co-occurrence complicates each condition and can make symptoms worse. Anhedonia PTSD. This condition is a common symptom following exposure to traumatic stress and a feature of the PTSD diagnosis. In depression research, this condition has been linked to deficits in reward functioning, reflected in behavioral and neural responses. Anhedonia schizophrenia. This is a condition that wipes your ability to enjoy or have pleasure. This mental health condition is often associated with schizophrenia, which can negatively impact a person's quality of life. This condition can manifest in various ways, from physical to social apathy. This condition can look like behavior you may not immediately associate with this condition. Schizophrenia is a mental health condition characterized by hallucinations, disordered thinking, delusions, and reduced social participation. Schizophrenia is a complex and typically lifelong condition, which is considered one of its negative symptoms. Anhedonia ADHD. ADHD can cause intense sadness, loneliness, and a lack of interest in life activities. People with ADHD and anhedonia may be more likely than others to develop depression and anxiety. One reason it is crucial to seek ADHD and anhedonia treatments is that therapy may help reduce the risk of complications, such as depression. Anhedonia depression. Depression is also a severe mental illness. It causes persistent sadness, hopelessness, and the inability to find pleasure in anything. During episodes of depression, you may also have changes in sleep and how you eat, feel anxious or restless, and have difficulty concentrating. Depression can make you feel worthless and guilty and drain your energy. Anhedonia treatments. Treatments for anhedonia typically include a combination of psychotherapy, medication, and lifestyle changes. Cognitive behavioral therapy is commonly used to help individuals recognize and modify the negative thoughts and behaviors associated with it. Drugs such as antidepressants and mood stabilizers may also be recommended. Finally, engaging in enjoyable activities, practicing relaxation techniques, and increasing physical activity can help manage the disease. How to cope with anhedonia? Even though this condition may indicate a severe mental health disorder, it's crucial to avoid self-diagnosis. Recognizing that the disorder is a common issue and can be treated with professional help is essential. Self-help strategies, such as talking to a friend or maintaining an active lifestyle, can also be necessary for managing symptoms. Additionally, since it can be a symptom of an underlying mental health issue, it's vital to seek professional help if symptoms persist. There's no known way to prevent the disorder, but treatments include cognitive behavioral therapy, psychotherapy, and medications to cure the condition. Regardless of the person's treatment choice, the individual must seek professional help to ensure proper condition management. The We Level Up mental health centers can conduct a thorough evaluation and offer a personalized treatment plan that addresses your unique needs. Remember, with proper treatment, you can recover and learn to experience pleasure once again. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.